In patients with thyroid cancer, radioactive iodine is actually used as the second part of their thyroid cancer treatment.
The thyroid is unique in the body in that it takes up iodine or iodine-related compounds specifically.
So radioactive iodine ablation or radioactive iodine treatment takes advantage of a normal process where the thyroid cells, whether they're thyroid cancer or normal thyroid cells or even Graves' cells, usually take iodine to make thyroid hormone, but this time we give the patient radioactive iodine.
The radioactive iodine can then bump off basically the thyroid cells, particularly thyroid cancer cells.
It's those residual cells that either still can harbor the thyroid cancer or can be a reason for thyroid cancer to return.
Following surgery for thyroid cancer, a patient is seen back in the endocrine office about 2 to 3 weeks later.
This just gives us a percentage of how much of the material went to that area.
During this time, they receive all the information and guidelines they need to anticipate their radioactive iodine treatment. The actual radioactive iodine treatment takes place about 6 weeks after surgery, or about 3 to 4 weeks after they're seen for their follow-up visit. When the patient comes in and receives a very low dose of radioactive iodine,
We give them a small dose to try to figure out how much tissue is left.
the following day they come back and have a whole body scan. That scan gives us a sense of how much radioactive iodine was taken up in the body, as well as where was it taken up in the body. The patient then comes in that third consecutive day, receives their actual radioactive iodine treatment at a much higher dose than they received 2 days prior. The following week, the patient comes back for what we call a post-treatment whole body scan. This whole body scan is crucial to serve as a baseline to understand where exactly the patient does have disease.
The advantage to doing that is if you can get rid of all the cells, then you can then use a protein that those cells make as a marker of cancer. And that protein is called thyroid globulin.
And we can follow that level chemically, and if that level all of a sudden becomes detectable, then we would have to worry about the recurrence of the thyroid cancer.
We use physical exam, we use imaging, ultrasound, and we use thyroid globulin measurements to determine if and when a patient would need another dose of radioactive iodine.